but she will be joining as soon as she finishes her appointment this morning. And knowing her, she'll probably call us from where she is, and I'm going to tell her to disconnect. But anyhow,
Okay.
Thank you. Good morning, everybody. I want to welcome you to the beginning of the Appropriations Subcommittee Marathons. Today, we are having conversations with the members of the agencies that are under the Judiciary Committee, and we have joining us will be Judicial first, and we'll go from there. But before I get started, I just want to see if any of my co-chairs or my ranking members are on, if they'd like to say something, but I don't quite see them on. So at 9 o'clock is an early time for a lot of people. I don't care whether it's Zoom or not. Business from your other job gets in the way sometimes too, so it makes it very hard. But I guess I'm just going to ask the House Subcommittee Chair if he has anything to say.
No, nothing to say. I'm just looking forward to hearing from the agency today.
Great.
Thank you, Madam Chair.
Thank you. Well, let me just see if I see I don't think I see.
Hey, just so you guys know, I'm double right now, so I'll jump on as soon as I'm done.
Okay. Well, no problem. But I just thank you for joining us for this early part and everything. And I let everybody know that there are several members who are going to be going back and forth between appropriations and judges, so we won't take it personal at all. And I know Judge Carroll wants to go and support his judges. So with that, I will go right to Judge Carroll and your team, if you would just give us a briefing and introduce your team quickly, and then we can get right into the questions.
Sure. Thank you, Representative Walker. Again, it's always a great pleasure to appear before you and the committee. Good morning, Representative Candelaria and all the other members of the committee. It's good to see you all again. I'm always mindful of the fact that both Representative Walker and Senator Austin admonished me to be brief in my comments. So I will be brief in my opening comments this morning. I do want you to know that we have a number of subject matter experts on the line today. And they range across the entire panoply of services provided by the judicial branch. And frankly, it would take much of my time to introduce everybody, but I can assure you that any questions you might have can be addressed here today by the array of subject matter experts that we have on the line. As I noted, Representative Walker and Representative Candelaria and other members of the committee, my remarks will be brief. I've submitted comprehensive written comments that contain an overview of the branch's fiscal year 23 budget priorities and a brief update on fiscal year 22 budget and details of items of concern that I'd like to briefly point out to you here. The written comments go into much more detail, but there are a couple of items that I would like to draw to your attention. First is the matter of the statewide lapse that appears in the governor's proposed budget. The governor's proposed budget adjustment includes a total statewide lapse of roughly $2 million. Now, despite the fact that the branch represents only 2.9% of the total general fund budget, the branch is now expected to shoulder 95% of this total statewide lapse. So of a $2 million lapse, the branch is being assessed a $1.9 million of the total $2 million lapse.
Excuse me, Judge Carroll, just Representative Nolan, thank you. Go right ahead, sir.
Sure, no problem. So I don't understand why there's such a grossly disproportionate allocation of that entire statewide lapse on one branch of government. I'd ask you to take a close look at that and eliminate what I consider to be a grossly disproportionate lapse assessment. Next is the matter of $2.5 million in Arpa funding for pandemic-related expenses. Although the governor referenced funding this program which was designed to enable probation officers to reduce recidivism among juvenile and adult clients, and the announcement of his legislative initiative to address public safety and crime issues. The funding is not included in the allocation of the Arpa, American Rescue Plan Act funding. So again, I would ask that you take a look at that and restore this important funding for this program, because doing so will allow us to get kids more quickly diverted into programs and services to address their individualized needs and get them on a track out of the criminal justice system. And there's no doubt that what we'll be able to do in terms of assessing and referring these kids to necessary services and programs will improve juvenile justice outcomes. And again, this is an ARPA fund. It's not coming from general fund Mondays. And the third matter I'd like to take a look at again is the matter of judicial compensation. The Chief Justice and I are requesting that the current rate of compensation for judges be increased. You'll recall that during the last session, the Commission on Judicial Compensation recommended that all future increases in judges' compensation be indexed to the Consumer Price Index for all urban consumers, otherwise known as the CPIU. The U.S. Bureau of Labor Statistics reported on February 10th of this year, just a few days ago, that the CPIU increased by 7.5% over the last 12 months. So this request that you add that second year increase in judicial compensation is made in an attempt to address the disparity that exists between judges and others who have received salary enhancements in the last 12 months, and in recognition of the elevated rate of inflation and the available state resources. You may also recall that last year OPM declined to include the second year increase, saying that the economy was still in a state of flux back at that point, and they would reassess the situation as we entered into the budget adjustment session. Well, certainly this is a great opportunity to reassess, and thankfully consensus surplus projections show a significant surplus in state funds, and the CPIU has increased significantly. And significantly also, we have run the branch in the last 12 months, and frankly, throughout the pandemic, in a way that we have developed some surpluses that might be able to use as carryover funding to address this issue. And again, that's addressed in greater detail in my written comments. So with that, my team and I are here to answer any questions you might have, and we're eager to do so.
Thank you, Judge Carroll. Thank you for that intro. And you've identified three things that I think we all agree are critical to your department. I'm just going to give a quick series of questions that we are asking every agency during this time, because of the number of retirements and the comments that I've gotten from so many people about filling positions and jobs and difficulties in that. First of all, do you do your own HR, or do you have to go through DAS?
We do our own.
Okay, all right. Well, that's good, because we can then compare. We'd like to know how many vacancies that you have in your department, how many retirements you're expected to have, how many applications to HR, so it would be your own HR, so it would be how many applications to your HR have been filed, and how many have been filled, and how long does it take once you are hired to be in your position of your job? Many people have 6 months, some people even have a year and a half. So we'd like to know how long it is to get people in place to actually work and in the capacity that you are hiring them for.
Certainly.
So you don't have to explain it to us. Libby took copious notes. I saw her head bobbing down.
Yes, that's right. Brian Hill is our HR director, who's also been monitoring this very carefully. Representative Walker, we've done an incredible amount of planning over the last 12 to 18 months regarding the anticipated large departure of senior judicial branch officials and the challenges that we're going to encounter in dealing with that issue. It's also significant to note that we're currently operating the judicial branch with 61 judicial vacancies. That's fully 1/3 of the number of authorized judges have retired, elected senior status. Prior to December 31st of this year, we had 12 of our most experienced and knowledgeable judges elect senior status, in large measure because it was in their economic best interest to retire rather than to stay in their positions as appointed judges. That's a real bad outcome. We're losing some of our best judges. We're now at a point where greater than 50% of our judges have fewer than 5 years of experience. So when we need experienced trial judges to address some of the most complex issues, the fact that we've lost these 12 and other judges has a real impact on our ability to do our job as effectively as possible. It's one of the reasons why I address the issue of judicial compensation. We should be doing everything we can to retain these senior judicial branch employees and judges rather than creating inducements for them to leave at this point. So with that, I don't know if you want Libby or Brian to address any of those concerns.
I mean, those are questions that we'd like answered in writing, because we've got a team on here that are going to be responding, are going to collect every agency's comment responses so that we can be given to all the legislators so we understand. I want my colleagues to understand the scope of what's going to happen by July 1 in our delivery system. And we've got to be prepared for that. So, and I got to keep going, but thank you for that. Thank you, Libby and Brian. I know I can always call on you guys for whatever.
My only comments, Representative Walker also addressed this issue, including a graph that shows projected retirements and many of the issues that you've raised.
All right. So before I turn it over, I have one other question. I looked over your one pager that you sent to us, and then you had some, and I looked at some of the things. The one thing that I don't see in here, and is because the reason why I asked this is because it's been in the newspaper. It's how are we providing services to juveniles, and I don't see anything in your one pager that really talks about beefing up the juvenile services and things like that. So I'm going to assume that Gary Roberge has the answer for me. So,
he does, and we touch upon it in our more detailed written submission as well, Representative Walker. But in the meantime, why don't I ask Gary and his juvenile justice team to specifically address the issue that you've just raised.
And Gary, just briefly, because if you could send it to us in writing so that I can share with everybody as Juan and Gary and his subcommittee work on this. We need that information. But Gary, go right ahead, sir.
Yeah, thank you, Madam Chair. And I'm Gary Roberge with the Judicial Branch. I think maybe we didn't get as specific in this communication because if you remember, we reported out to this body on December 13th. We presented on juvenile justice issues to the Appropriations Committee. And really, and we did provide follow-up documentation based on that presentation that day. There were multiple questions from many of the legislators on the screen here this morning. And we can certainly do that again. But, what we identified as the biggest need areas in that presentation, in that report, was really the competitive wages of the individuals working in our programs. We had identified, the issue that we're having trouble staffing our programs right now, specifically the clinical positions in our programs. So that is something that, if that could be reviewed and addressed, I think it would be beneficial to the entire juvenile justice system. The other area that we talked about is just some additional programming around the behavioral health, the kids that are coming into our system, and currently, we don't have a specific program for the aggressive, assaultive type of kids with behavioral health issues. And more often than not, they're ending up in our detention centers, our residential centers, I should say. That's the name of the centers now, residential centers. And if we could partner with our community providers to develop a program to address kids that are in that specific situation, that status early on, rather than coming through our residential centers, that would definitely be beneficial to the juvenile justice system. So really, from the branch's perspective, it's the wages, competitive wages. And I know that you all on this screen have heard that for the last 6-8 months in many different forums from many different state agencies about our inability to get the appropriate people into the appropriate positions, right, for to do the work with the kids. So we will certainly send that supporting documentation to Sue again, and she can share it with the rest of the Approach Committee if that's what you'd like us to do, Rep. Walker.
Absolutely, because I mean, and especially the higher end kids are the ones that seem to be creating the most havoc, and that's why we really need to put money into those positions more than anything else. So I thank you for that. Okay, now everybody, I know I asked a lot of questions, but those were questions that I got from 2 other people that can't be on here. But I ask everybody to do 2, and then and if there can be takeaway and they come back and answer, it'd be really appreciated, so that we can get as much information from the agency as possible at this point. So I'm going to go to the subcommittee. Well, first I'm going to find out, are my ranking members on? Is Senator Minor or Representative France on? Representative France? No. Okay, so with that, I will go to Representative Candelaria.
Thank you, Madam Chair. Good morning, Judge Carroll. Just 2 quick questions. I just want to follow up a little bit on the issue of security for the judges. I know that was brought up last time. We had an in-depth conversation. There was some measures that were being taken to utilize other resources to address the issue. So where do we stand with that currently?
Thank you for that question, Representative Candelaria. It's a big matter of concern for all of the judges at a couple of levels. Number one is the physical security of our workplaces. And if you look at page 7 of our written submission today, we have an entire section which deals with courthouse security. Specifically, we have been granted the bond funding to address some of the screening issues that exist in some of our older buildings, and those improvements are underway. Obviously they take a great deal of time. During the pandemic, we've had a number of security issues, but I'm very proud of the way that our judicial marshals have handled them. But we've got a real retention issue with our judicial marshals, and that has a direct impact on our ability to provide adequate screening at all of our facilities. As you well know, the state police, municipal police are in search of candidates to fill vacancies within their own departments. And we in the judicial branch, we just are not competitive enough with those opportunities that are being presented to our candidates after we train them. And it's had a devastating impact on us, and it's had an impact on our ability to provide security in some of our facilities, such that 2 of our facilities we still suspended operations because we just don't have enough judicial marshals to provide security at those buildings, nor do we have enough marshals in our transportation unit to run transport from DOC to those and all of the rest of our courthouses. We've expanded the nature and scope of matters that we handle remotely from DOC facilities. We've had a great collaborative relationship with Commissioner Quiros on those matters, and we're trying to eliminate the need to bring people into courthouses to handle what are commonly routine matters that take less than a minute or so. There's no need to invest such a great deal of time and expense in transporting folks on matters that can easily be handled virtually. The other issue of concern that you may be aware of is some of the online threats that are being made against judges and other members of state government, including members of the legislature, the attorney general, the governor, and others. We've been working closely with the state police and the FBI to address these concerns, but I can tell you, I routinely get inquiries from our judges who said, geez, I just read about this issue about me online. They've identified me, my personal residence. They've posted photographs of me and my wife and my children or my husband. And I'm concerned. So we have a special unit within our Judicial Marshal Services unit to address these threats against judges and judicial branch employees. And it really is a full-time operation. On the line, I do have Director Don Murphy, who might be able to put a little more meat on the bones in terms of the challenges that we're currently facing in providing security in our facilities. Director Murphy.
Can we abbreviate because we're running out of time?
Sure.
And
okay.
I've got at least 4 more legislators that have
okay.
questions.
Thank you.
But he can, if we need more information, Representative Candelaria can follow up on that. Okay.
Thanks for that question, Representative Candelaria.
Yeah, and if we can follow up, because I know this has been going on for a long time, right? The issue that you've been facing with the marshals, that's something that we've been trying to address for the last couple of years, and it's still not resolved. And
that's
that
correct.
is an impediment for you to really do your job and have security for all your workers there. So very quickly, and you need to respond now, but I want to know, you have a backlog on foreclosure mediation program. There's also on a family support matter backlog. If you can let me know how big is that backlog and what do you need? I know there's some funding allocated by the governor to address those backlogs.
Right.
We
have all that information. We have it in graphic format. We can provide it for you immediately. And one of the issues that I addressed earlier was that failure to provide the Arpa funding of $2.5 million, which specifically includes funding for those concerns that you've just raised.
Okay, perfect. Thank you, Madam Chair.
Thank you, sir. Representative Porter.
Thank you, Madam Chair, and good morning, Judge Carroll.
Good morning, Representative Porter.
Turn my video on so you can see me. Not a question. I just really wanted to let Madam Chair know and the other folks on the call that Brian Hill actually came and did an outstanding presentation to the labor task force that we have on the state workforce and retiring workers. So Rep. Walker, we do have quite a bit of information we can share with you, not just for Brian, but we're also doing it with higher ed across state agencies. So I just wanted to thank Brian again and to let you know that we do have some of that information already compiled.
That's great.
Yep. You guys are doing a great job. We were very impressed. We were like, maybe we need to just mimic what you guys are doing over there at Judish. So
thank you, Representative Porter. That means a great deal to us. Thank you.
You're welcome. Thank you, Madam Chair.
Thank you. I'm not sure, is Representative Pavlik-D'Amato waving at me or is she saying she has a question?
Oh, well, both.
Okay. Go ahead, Representative D'Amato.
Thank you. Good morning, Your Honor.
Good morning.
I know we talked a little bit about the increases for judges. Did the request you put in include any other wage increases for employees or I'll say like, not that minimum wage. I don't know if there are any minimum wage employees, but I'll say in general, due to arbitration and those agreements, any funding increases in your request for that take those into account?
No, those are all part of the collective bargaining process, Representative Pavlik-D'Amato. So I don't think there are any specific requests for enhanced funding for any employees. Libby, any further response to that?
The only thing I'd like to add, Judge Carroll, is that we just sent over an arbitration award for the AFT union for consideration by the legislature. So we're looking for a response on that arbitration award. And if it is approved by the legislature, we will be obliged to fund that this fiscal year because that award pertains to fiscal year 22.
Okay, so then will you revise your request, or is that just something we'll have to, I guess, take into account in appropriations and change the numbers after? Maybe that's a question for the chair.
We would have to engage in conversation and confirm that we have the resources lined up to meet the obligation of the arbitration award. So yes, I think we would need to pin down the details on that in the context of the subcommittee, perhaps.
Okay, thank you. And my other question is, Are there any plans to reuse the Connecticut Juvenile Training Center? I know there's been talk about utilizing it for some educational opportunities or mental health assessments for juveniles. Is that been taken, or has that been talked about at all?
Of course, it has been talked about, Representative Pavlik-Tomato. It's important to note that that facility is not a facility under the auspices of the judicial branch. We issued a report not long ago addressing this very need and made certain recommendations, but that's not a facility over which the judicial branch has any control or authority.
Oh, true. Thank you very much. I appreciate it.
Okay.
Thank you. Are there any other questions from any of my colleagues right now? Wow. Did we get this right on the button? Judge Carroll, I don't think we've ever done that before. Ever.
Would you like me to fill in some space here, Representative Walker?
If you have anything else you'd like to expound upon, feel free. Otherwise, everybody got the reports and the Administrator Keen. Yes.
Yes, ma'am. You because I always like to give Judge Carroll extra time. Judicial actually goes to 9:45, ma'am, if anybody has any other questions. So.
Oh, cool. Okay. Oh, then that gives us a little bit more time. Excellent. Thank you. Well, in that case, I will go into the request that you have for the victim services, the 14 million. And is this a response to the fact that the federal funding for VOCA is not going to be available for the next year or two? Is that what this is, or is this in addition to what VOCA was funding?
I think that's part of it. I'd like to have Libby respond, and our Director of Victim Services, Linda Semino, is also on the line, who may be able to provide greater detail. Libby?
Okay, great.
Sure. Thank you, Judge Carroll. Yes, the VOCA funding, as I call it in shorthand, the victim services really addresses the need that's in the community. And fortunately, the Arpa program recognizes that the pandemic put extra pressure on families, and it's manifests itself in this disagreeable, uncomfortable way. So the funding is intended to basically hold programs harmless in this intervening period where a new federal formula, a funding formula, is applied. So it's not enhanced funding, it's just to sustain at the current level of funding. And with that general explanation, I'll turn it over to Linda Semino to add any additional detail.
Good morning, ma'am.
Good morning. Sorry, I'm having trouble with my video. Sorry. So I'm joined here by my colleague, James Morgan, who is our program manager for fiscal assistance. It is, what Libby said is the sum and total of the problem. We have experienced in Connecticut significant decreases in our VOCA funding since the high mark of 2018. This reduction for the current grant period could be catastrophic without the ARPA funding, as we have 50% less funding through VOCA available for the community nonprofit agencies. And we are also attempting to meet the needs of the new executive order from our president to provide greater services to, excuse me, underserved populations.
So the funding that Connecticut received under VOCA, some people are, and I don't know, but some people are telling me that it's more than that. Do you know if it is more than that? Are you doing all the funding that you are aware of, or were there some agencies or some pockets that were not fully funded?
I'm not sure I'm sorry, I'm not sure if I understand the question. I can tell you, and Jim can fill in the details, but we are currently under contract with nonprofits for
$29.5 million are our current contracts.
Okay, but the amount that I'm looking at is only 14. That's why I'm asking. Because and that's what, if it's more, then I want, unless you're underwriting a portion of that with your budget and you're just passing on to us 14. So I'm trying to understand what we're doing, because we do want to make sure that the VOCA funding gets paid for.
Yes, we have about $15 million available in VOCA funding. So the addition of 14 ARPA funding would help to maintain our current contract levels.
Okay, so you have 15 million in your budget now to cover, and this to cover. Okay, and then this plus the 14 equals the 29 that our state is supporting. Correct?
Correct.
Okay, all right. That's what I, because someone else brought that up and said these aren't all the funds here, and I didn't know that. So thank you.
We will make sure that we synopsize this for you with the greater clarity, Representative Walker.
Thank you. So that, because I've got legislators who have been calling me about this,
right?
And I wasn't sure, and I just wanted to make sure that we get everybody, so that they, not that they go away, but they stop calling me up with the questions.
I understand.
Okay.
I understand.
Thank you. Representative Candelera.
Just a quick question on, where was I? The $2.9 million in ARPA funding for the expansion of opportunities for individuals on bail. Can you talk to me a little bit about that, and what would that accomplish?
Sure. I think that this is a perfect opportunity to segue to Gary Roberge to talk about how that funding would be put to use in the very areas that you're talking about, Representative Candelaria. Gary?
Yes, thank you, Judge Carroll and Representative Candelaria. The request for the 2.9 is for adult and juvenile probation to do additional enhanced field work with the clients on their caseloads and the families and the kids on the juvenile side. Specific to the bail, though, there's a couple of other things that are looped into that. And one, Rep Candelera, is the after hours work that some of our bail staff do with the judges on nights and weekends when the police arrest somebody on a warrant. They can access a judge. So on a warrant, typically, the court sets a bond. And if it's a lower level misdemeanor type of charge that doesn't warrant somebody remaining incarcerated, from our perspective, we'll call a judge that is on call for us, again, on nights and weekends, review the case with him or her, and then they can change the bond on the warrant. So that's to cover the cost of that service. And then additionally, as you know, on the juvenile side, we have the order to detain that happens after hours. So there's another funding component to that to cover the overtime costs for that as well.
Thank you.
Yes, sir.
That's it, Madam Chair.
Okay, thank you. Thank you very much. Representative Nolan.
Thank you, Madam Chair. To Gary, now, who's the overtime cost specifically for? Is it the on-duty officer that's applying for it, or is it the judge?
No. It's
not the judge.
Not the judge. It's
okay.
It's for CSSD staff that are covering. So the approval for the adult and the juvenile field work has to go through an office supervisor, right? We have to clear all after hours activities to make sure we know what everybody's doing. So there's an approval process as to who's going to go out and do what work on nights and weekends with that respect. But then the other two items I was talking about with bail and the order to detain, those folks are actually on call for the weekend, so that if we get it, so that we're compensating them for being on call and available throughout the course of the weekend.
Okay.
Like you, Representative Nolan, judges are available 24/7. We have rotations on weekends to address search warrant issues or address warrant issues, findings regarding probable cause. So there's no enhanced payment to judges for that. That's part of their job.
So it's just for office staff, basically?
Correct.
Right.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you. Representative Pavlik D'Amato, do you have another question? Go right ahead, madam.
Not on this. I'll come back to mine after.
Well, no, they're not on judiciary. Judicial? You have no
Well,
questions
actually,
for-
yeah, it was just a follow-up to my other one, which was about the.
Go right ahead. Go right ahead. Go right ahead.
Okay, it was just about the juvenile training centers and about if there was any conversation with DCF. I think DCF might have been involved. So
when you say juvenile training centers, I assume you're talking about the former juvenile training school.
yes. I'm sorry.
Okay.
Yes.
Yes. All right. Yeah. I mean, as we made our proposal, we consulted with all interested parties, DOC, DCF, JJPOC, and the recommendations that we've made were not unilaterally made. They were made in consultation with other impacted agencies.
Okay. All right. Thank you very much. I appreciate it.
Just to expand on that, it was a request from us to understand what are the options for addressing populations that are being detained for either trial or are also being detained in Manson youth. And part of the problem is finding a facility that doesn't cost us $50 million in order to do that, but still provides us with the scope of the services that are necessary. There's got to be retrofitting because the original juvenile training school, the way it was designed much more for an adult facility than it was for a juvenile facility. And the design that was made and copied was made from a prison for men in Ohio. So if we want to make this a facility that allows the redevelopment of services for kids that need them, especially the ones that we are experiencing now because of the pandemic and all their outcries, we've got to have a facility that has enough social service development and things like that that are going to reach those kids before they have a chance to recidivate into other issues. So people are still thinking of the CJTS that was under DCF. That is not the proposal that judiciary has put forward to the committees, where they were part of I think it's a 20-member group. So it is still in conversation because we need a facility, but it's not been laid out because we're still trying to figure out exactly what population we are going to be able to do. And quite honestly, the caveat also is that we now have a Department of Justice investigation into the population that we were talking about moving over. So we have to address that before we can do anything. So we're kind of in limbo right now with what we were trying to do with that, because we cannot get into the middle of obstructing justice, I guess, or something like that. So we just have to be a little bit time sensitive, but we have to also understand that that's what needs to go on. So thank you for that question, though. Are there any other questions from any other members of the group? And Senator Austin joined us, and I asked your vocal question, so I'll give you the answers later. So we're good. You're muted, Senator. You're muted, Senator.
I'm going to turn my video off because I'm driving.
Okay, good idea. Thank you. Thank you very much. Well, thank you, sir. Thank you for coming before us, and we look forward to probably following up with, and I'm hoping everybody has a chance to read your documentation that you sent, and Sue was very good to send that out last night to everybody. so that we all have that information. And any information that you send, we ask you to send it to Sue Keen so that she can send it to, you know the drill, but so everybody else can hear. So that everybody on the committee, Appropriations Committee, can have access to that information. So thank you and have a great day.
Thank you, Rep. Walker. Thank you.
I'll see you on the other Zoom.
We will. That's where I'm headed right now.
Okay, thank you. Bye-bye. Bye,
Bye.
guys. Thanks.
Bye.
Let's see. Well, we're about 2 minutes, so we'll pause for a minute, for a couple of minutes, so that everybody can go re-get their coffee or whatever, and then at 9:45 we'll resume with Department of Corrections. Okay.
Got it.
Everybody can go re-get their coffee or whatever, and then at 9:45 we'll resume with Department of Corrections. Okay.
Susan, good morning. Susan?
Madam Administrator, can we start the taping again? Thank you. Good afternoon, everybody. We would like to resume the Judiciary Subcommittee, and next we have the Department of Corrections. And I want to thank you guys for being here and being prompt and helping us to get started. So I will ask you to give us some introduction, sir. Not of all your staff. We don't need that because we only got 45 minutes, but so that we can get into the question and answer. But thank you very much, Commissioner, for joining us and helping to provide us with some answers. And there's going to be probably a lot of things of follow-up that we're asking. And I will ask you that right now, just so that you know it, and then we can get that later. But we're asking every agency how many vacancies they have in positions. We want to know how many retirements are they anticipating by July 1st? How many applications for positions do you have in Department of Administrative Services and the Human Resource Department? How have you filled any? And how long does it take before someone is on the field? And for those who are trying to keep track of this, if you need, we can send you these written questions so that you can have them. And who would I send them to? Send them to you, Commissioner?
You can send them to me, Madam.
Okay, thank you, thank you. So with that, go right ahead, sir. Go right ahead.
So good morning, Senator Olson, Senator Milner, Representative Walker, Representative France, and members of the Appropriation Committee. I am Angel Quiroz, Commissioner of the Department of Corrections. I thank you for the opportunity coming before you to discuss the government proposed budget and the Department of Correction. With me today are many of my staff in case we need them. I won't go into the names. I have submitted written testimony, and in the interest of time, I will not read it so that we can proceed directly to your questions, Madam.
Thank you, sir. Thank you very much. That was a very quick intro. So
Yeah.
I want to start with I believe that Zoom is Senator Austin. If members, if you have questions, please raise your hand and we will go right into it. So Senator Austin.
Thank you very much, Madam Chair, and good morning, Commissioner. It's a pleasure to see you. I have a couple of questions relative to policy that we put in last year to see where we are, and that is the free phone calls, the email process, and the tablets. Where do we stand? And I appreciate you answering my questions before, but I want to sort of ask this on the record now so that we can make sure that any tweaks that we need to make, whether it's to the amount of money that we're paying for some of this or whatever we're doing, we know about it right up front. So if you could get into the detail relative to that.
Absolutely. Good morning, Senator Olson. Thank you for the question. So as far as the phone calls, the free phone calls will go into effect October 1st, 2022. We've been working with the vendor on installing new phones in housing units. As you can imagine, based on structure issues, there's limited space to add additional phones in some of the facilities. I will be embarking on using the tablets as telephones to provide us with the additional telephone lines so that the offender can make a phone call from their cells during recreational time periods. As far as the tablets, they're in E12 correctional facility, 11 correctional facility. We're right now currently working with Hartford in installing their tablets. We're going to be moving on February 22nd, 2022 to New Haven. And the last one will be Bridgeport, and date to be determined. Bridgeport is going to be more difficult because of the charging stations and the fact that that facility does not have electricity in their cells. So that one will be more difficult, but I'm hoping that by the end of the spring that we'll be up and running in all 13 correctional facility. As far as e-messaging is only piloted at McDougall Walker. McDougall Walker has about 1,600 offenders residing there right now that are using e-messaging. The budget does not cover the expense for e-messaging. So I'm on a standstill as far as allow e-messaging to go off statewide. We project based on a year of data of usage at the McDougall Walker facility that we will need an additional $3.5 million to support the e-messaging. The current contract with e-messaging, the state does not receive any commission. I want to repeat that again. The state does not receive any commission. It's basically a stamp. A stamp is cost 20 cents for outgoing messages. Then the party and the community receives the message. They will pay another 20 cents to the vendor to send in a message. The message from inside is about 5 pages long. The message coming in from the family member loved one can be up to 7 pages long. What was the third question, Senator Olson?
I'm sorry, it took me a second to unmute myself. I wanted to know, excuse me, the tablets, I wanted to know where they were. You answered that question. You talked about the phones and the emails, those were all incorporated into that one question. So you've given me the answers on all of that. My other question is related to administrative segregation. And I'm curious, does every facility have administrative segregation? Or are you concentrating that in just a couple of facilities? And I will have another question, but I'll come back at the end.
So with the closure of Northern back on July 1st, 2021, the administrative segregation program was moved to the Walker, Medulla Walker, has AS phase 1. Then you have Gardner will have a small AS phase 2 and 3, and Corrigan will also have a portion. So those are the 3 facilities that we're housing AS. I need you to know too that currently we only have 20 individuals under my custody that are participating in that administrative seg program. Back when I was a warden in at Northern, we had about 222 AS. So we've come a long way in progress with the AS program.
Thank you for that. And thank you, Madam Chair. And I will come back for another question.
Thank you, ma'am. Thank you. Thank you, sir. Next, Representative Johnson.
Thank you, Madam Chair, and thank you for sending the information ahead of time. I am interested in the work that you're doing when incarcerated prisoners are discharged, and what types of things are you providing for them in the community at this point in time? Your remarks that we read did indicate that you're doing some things, but I'd like to know more about it.
Okay. So any offender upon their discharge date, 90 days prior, we have every facility has a reentry counselors that will help the individual transition into the community. For example, a reentry counselor will assist an individual that's going back into the community to activate or apply for their insurances, so that when he or she is discharged, that insurance is hopefully approved in the process. Then you have the discharge planners that will deal with the individuals that have a medical score, a mental health score of 3, 4, and 5. Those are more intense programming, and they connect with the communities. They connect with DMIS. They'll connect with the programs that are available out in the community, whether it's mental health, whether it's addiction service, and so forth, to connect the individuals and make sure that when they walk out, that the services and the appointments that they need out in the community are already booked and ready for them. When it comes to parole and community services, we have about 7 residential programs and about 24 work release programs. Part of that program too, you have the 3 of those programs are the mental health units. We have a sexual treatment unit, and then we have an app program. So those are the individuals that are out in supervision, that if they for somehow has a missteps with drugs, that we can put them in inpatient program or outpatient program besides bringing them into the correctional settings.
So my question also has to do with whether or not you're providing identification so that they can get some of the services that they might need. Housing, I'm more concerned about making sure they have a place to live, a place to go, the kind of support that they might need. What kinds of job opportunities are you providing for them? Those are the kinds of questions that I'm wondering about. And is it going for everyone, or is it just the people who are getting out for good time and the people who are not fulfilling the whole sentence, not getting the services like has been done in the past? So I just want to make sure people are getting the identification they need. How much money are they being discharged with?
So this is a loaded question, so I'm going to try to answer everything that you just said in my direction. Let's start with identification. Identifications is a very difficult task for us. I can tell you that we're up to probably 62% of the individuals that discharge from the Department of Correction has a form of identification. I can tell you that in 2021, 4,700 identifications were issued to the individuals under my custody, even during the pandemic. 1,700 were birth certificates, And birth certificates cannot happen until they have to be within 3 years of a discharge. So we got last year we got 1,700 birth certificates, about 1,600 social security cards, about 358 driver's license, and another 700 state IDs. So the work is a very difficult task to accomplish. Many of these individuals that we struggle with are the individuals that are in the county jails that are with us for a week, 2 weeks. They end up going to court and they end up discharging from court. The process probably has begun, but it has not been completed. And those individuals are released into the community without identification. And there's also a certain small group of individuals that does not want the identification because they have the identification when at their residence. As far as homelessness, we have partnered up with the Coalition to End Homelessness, and I can tell you that in March 2020, when COVID broke out, we were at that month. We had 60 individuals that were discharging, and all 60 individuals were placed in a hotel and have somewhere to go. We average about 20 to 25 discharges that are identified as homelessness. We work with the coalition, we work with the roundtables to try to find these individuals a resident to go. Individuals again, the group that's the hardest for us with the homelessness are those individuals that are going to court and they're discharging to court, that they might have been with us for over the weekend or a week or two that we did not have the opportunity to. As far as job assignments, we have 24 programs that are in the halfway house that are work release programs. Right now, I have about 874 individuals that are participating in that program. That program is open to anybody and everybody who's eligible for community release package.
Okay, very good. And final, one last question, if I may. The other thing is, in terms of the discharges and the closing of the prisons, what have we done to mitigate any possible contagion between prisoners? Is there enough space? Do they have enough room in these more confined quarters? I'm just wondering. It sounds like we've consolidated a lot and closed some buildings, but are our prisoners having enough space with HVAC systems that can make sure the air is clean and that they're mitigating any possible contagion?
So with the closure of 2 facilities, the closure of Northern, that had 91 individuals residing in Northern, that had no impact on us as far as bed space. With the closure of the Rogalski building, that had the capacity of 454 individuals. At the time of closure, it had a little bit over 300 individuals in there, so that did not have any impact for space. We do run into problems in the county jails with spacing and the ability of social distancing in the dorms. Which is probably, you're talking about each county jail has anywhere between 2 to 4 dorms. The majority of the housing units, the majority of our housing unit cells, which is 2 individuals confined to a cell. We do maintenance with the air filters and change the air filters. I can tell you that since COVID, March 20, we have 1,500 cells that are offline and are only utilized for quarantine the individuals when they come into the county jail. I have another facility that has 220 cells offline because of a maintenance project. That's Osborne, and I have Carl Robinson is doing bathroom renovation. That's another 180 cells. So I have about 1,500 cells right now that are being utilized because of COVID and the project. So we have plenty of spacing. I can tell you that the dorm settings in Carl Robinson, Willis Cybulski, we're at probably about a 50% capacity. So social distancing is can be maintained.
What type of filters are you using?
I'm gonna have to get back to you on the filter of the type
Excellent. Thank you so much, Madam Chair. Thank you, Phil.
Thank you, sir. Representative Nolan.
Thank you, Madam Chair. A couple of questions were asked by Representative Johnson, but I want to try and go back to the phone messaging, the e-messaging. And now the reason for the e-messaging, could you explain, is that because there weren't enough phones in the facilities, or is that just another way for them to communicate?
The e-messaging is I'm looking for what's the right word I'm looking for. The e-messaging is
It was a request from the legislature. We had asked for it, and that was part of addressing the cost for the phones.
So when the legislation passed last fall, free phone calls, free e-messaging, anything with communication with the family members. E-messaging is part of the tablets, that we enacted at a MYI. It has nothing to do with the phone calls. It's just like a text messages. It's a lot quicker for the individual that's in the custody to communicate with the family members. There's not the delays of the U.S. mail system, and somebody's waiting for his letter to come in, or the letter never left the facility, and so forth. So that's what e-messaging is. It's like a text. As far as the phone, the tablets being utilized as a phone, that is something that I'm a pilot, because we don't have space in the correctional facilities to add additional phones for the additional increase that we're going to see in phone calls come October 1st, 2022, when they're free.
Yeah, and that's what I was trying to reference, the tablet phone thing, because of the lack of space. Now, are those tablet phones, are they a video, or that they're going to be able to see their family members, or just a blank screen where they can only hear voicing?
Just hear voice, no video.
The next question would be about the administrative segregation. You talked about the AS phase, the different phases. Could you explain those?
Yes. So when an individual is being considered for AS hearing, that individual will receive notification, written notification, and provided with the evidence. That individual is, after the hearing, is classified as an AS. Phase 1 of the program is about a 90-day length in time. Then you have phase 2, which is about another 90 days, and then phase 3, which is probably like 60 days. So within an AS program, an individual can be in and out of an AS program within 10 months to a year. And so the AS phase 1 is the, and understand this too now, with the governor's executive order, that AS, so an individual that seriously assaults another individual where he's being considered for AS, that individual will go into AS phase 1. That individual is automatically coming out of the cell for 4 hours a day with the new executive order. Just like if he was in general population, he's just going through being transferred to a different facility, to the Walker building, and then different cell. But that individual is coming out 4 hours a day. Prior to the executive order, that individual would have been secure in his cell 23 hours a day. So it's a huge change.
Yeah, and that was what I was gonna, that would have led up to my next question, but that's what I wanted to see, if they were coming out more than a different 23 hours than you said, the 4 hours. So I appreciate that. I'm gonna stop there, and I'll come back for other questions.
Thank you, sir. Representative Candelaria.
Thank you, Madam Chair. Good morning, Commissioner. Just two quick questions. If you can just give me a quick update on the inmate medical.
No,
Representative Johnson. Representative Johnson, thank you. Go ahead.
On the inmate medical, I know that we add additional dollars to that line item. Just if you could talk to me a little bit about funding, staff levels, and where are we within that area?
Thank you very much for that question. And let me start by thanking this group of staff that have dealt with the pandemic for the last 2 years, that I've had to, some of them involuntary, and transfer them to the medical isolation unit so they could provide 24 hours medical attention to the sick patients. These individuals, nurses, have done a tremendous job for us And I'm proud of them, of the hard work that they put. Medical unit has been, the hiring of medical nurses has been a challenge. Let's go straight to it. It has been a challenge for the agency. We have been in conversation with DAS. We have been in conversation with OPM. We have changed some of the criteria to get a bigger, larger pool of candidates. We have gone out on job fairs. We have gone out to nursing schools. The bottom line, we're doing exit interviews when we hire and they come out. And the bottom line is the wages. It's the wages. We are not competitive. I'll give you an example. 3 weeks ago, I lost 3 nurses from New York, and Middlesex Hospital opened up a branch in New London, and they went into that branch because they were getting higher pay, you know, the wages. Right now, I would say we have a little bit over 100 vacant nursing positions that we're actively seeking to backfill. And again, it's hard work with DAS, hard work with HR. We have hired probably about 160 nurses due to retirements, due to resignations, due to them leaving for better paid jobs. Some we have fired because of misconduct. It is a challenge for us. And, you know, we've been in conversation with DAS and OPM about the wages and to be competitive. And goes also with the mental health clinicians too, underpaid. We're just not competitive with the private sector in the market.
So if I understand correctly, currently you have 100 vacant nursing positions?
100 plus, yes.
100 plus, right? So I'm assuming that you're faced with a lot of challenges to provide care. How about to the providers? Is there any shortage in providers?
There are also shortage in providers with the APRNs and the doctors. That is also a challenge with the starting wages. But we do go and sell staff, and we do have a vendor that we do contract with to get the help that we need when it comes to nursing, when it comes to ARPN, so that we can backfill some of those positions. But we want to backfill them with permanent. For our staff, with permanent staff, so that we can improve the care.
And I understand that. I think the issue with the shortages and the competitive salaries are being paid to nursing providers. That's a problem throughout the whole state of Connecticut and even the nation. In your request for funding, did you make any requests to adjust those salaries and be more competitive?
That is being handled right now with CBAC negotiations. I was in conversation with OPM, and hopefully when CBAC negotiations is done, we've made some headways with that. Okay.
And I guess my last question is, there's an allocation made by the governor of $1.7 million for 19 new positions support mental health, and I believe 13 for education. Or 6 mental health and 13 for education. Can you talk a little bit about what that will be accomplishing, those positions?
Sure. So that is part of the Department of Justice report findings. I will not talk too much into details about that because we're in negotiations, but that is being proactive in the agency in conversations with OPM, identifying exactly the additional staffing levels that we're going to need. And it's basically in 3 categories: operations, mental health, and school. So those 6 mental health staff members will get us in compliance.
Can we need to stay away from the subject there. So I apologize. I just heard that. So once we have some settlement agreements or something, then we can talk about it. So I'm gonna move the subject right along. Go ahead, Representative Candelaria.
No, that was my my last question.
Okay, great.
So thank you.
Okay, Representative Rosario.
Thank you, Madam Chair. Good morning, Commissioner. How are you?
Good morning, Representative Rosario.
My question is along the lines of mental health, and we've been talking about solitary confinement or just mental health in general in the legislature this session. And one of the things I wanted to ask is, have we considered administering either hemp oil or CBD oil to some of our inmates. I know many, obviously, it's been stressful with the pandemic. And I know inmates are currently receiving narcotics or pain medication because they have no other option other than pain medication or narcotic. Has the state of Connecticut thought about or administering CBD oil or hemp oil as an alternative for inmates?
Representative Rosario, we have not, and to be honest, I'll have to look more into that with my staff to see what are the benefits. I can tell you that that we do have the methadone program and and so forth. So we have not, but we will look into that. And as far as solitary confinement, the executive order governor issue out has eliminated solitary confinement. We're strictly following the Nelson Mandela definition of solitary confinement that the United Nations utilized, and that is securing yourself for more than 22 hours a day for more than 15 days. We're strictly following that. So there is no solitary confinement in the Connecticut Department of Corrections.
Thank you for that answer. My main thing is, being that, we're kind of going into another surge with opioids in and out of jail. Maybe we can offer alternatives such as hemp oil or CBD. I know in Connecticut, we produce lots of hemp and eventually lots of cannabis. So that just want to throw that out. There's an alternative.
And absolutely. And I will look into that. And let me advise you to that we have in 10 of our correctional facilities, we do have the methadone program that addresses the struggles that the individuals in my custody may have with opioids.
Thank you, Commissioner. Thank you, Madam Chair.
Thank you, ma'am. Thank you, sir. Senator Austin.
Thank you very much.
Okay.
But I don't know if you want Representative Porter. She hasn't spoken yet. So you want me to
you're right. You're right. I'm sorry. Representative Porter, I didn't see your hand.
Thank you, Madam Chair, and thank you, Senator Austin, for the courtesy. Good morning, Commissioner. How are you?
Good morning, Representative Porter. How you doing?
I'm doing well, thanks. I wanted to just circle back on two things. Actually, you talk about the methadone clinic, the methadone services that DOC provides. Can you tell me who you are in partnership with? Is there one vendor? Are there several vendors? Who provides those services for you?
I will get you the name of the vendor. I believe there's 2 vendors that we're contracting with, and the program at York, that is our program. We got approved by the FDA to run our own methadone program at York.
Okay. And then the other thing you just answered with Rosario. Is it correct that you stated that there is no solitary confinement in the state of Connecticut?
That is correct. Defined by the Nelson Mandela rule, the United Nations utilizes, which is 22 hours locked in a cell for more than 15 days. An individual that receives a Class A ticket, say for an assault, that individual is going into a restrictive housing unit, and that individual is coming out of cell for 2 hours a day, and we cannot keep them in there longer than 15 days within a 60-day period.
Okay, I will respect the fact that you are using that definition, but I don't agree with that definition. And I would love to continue this conversation as a sidebar, because I have a real issue with us thinking that, 15 days in solitary confinement, 2 hours a day out of a cell does not constitute isolation. I believe that it still does. And it has a tremendous mental and traumatic impact on the people that are being held in the facilities. So I just wanted to put that on the record, because that's a little disturbing to me that we're saying we don't have solitary confinement in the state of Connecticut based on the Mandela definition. And I just wanted that on the record. Thank you, Madam Chair.
Thank you, ma'am. Thank you. Senator Austin.
Thank you very much. So I wanted to talk a little bit about mental health amongst staff for a little bit, Commissioner. We put in the high-tech program, or actually the high-tech program's been in since before I retired. So that was back in 2010. how are you finding the staff dealing with the problems relative to COVID, the fact that it's a congregate living environment? There's been certainly a high number of staff as well as inmates who have had COVID. How are we supporting those staff members?
That's a great question. I would tell you that my staff are tired. My staff have taken a mental beatdown during COVID. If you look back in December, into late December into January, I had 1,400 staff members out recovering from COVID. I've had over 4,466 staff members been affected with COVID since the onset. The high-tech program is definitely beneficial for us. We continue to engage with them on a weekly, monthly basis and try to incorporate some of their strategies into our correctional facilities. We also have seen an increase in our employee assistance unit and not EAP, our own. As you know, we've developed our own employees probably about 5 years ago. We're seeing an increase of referrals that our staff are putting in for services. I'm seeing an increase of time off. I'm seeing an increase from my staff on FMLA. These last 2 years of COVID, it's been difficult for them, and they've come in and carry out their duties. But COVID has taken a toll mentally, the mental health on our staff, and I got to do more for them. We got to do more for them and make sure we provide them with the resources they need to address those issues. And any help in that area will be beneficial for my staff.
So I've been talking to a couple of the units around the state about the stressors that they're feeling. And so do we have enough line staff within the Department of Correction now relative to the amount of overtime that people may be doing? Now, I started in 1989. Back then we didn't have enough staff. I think we started similar timeframes. You're probably much younger than me, but I remember working shift after shift after shift, day after day. Are people being required to work overtime more than a day? But a one time? Is it 2, 3, 4 days of a cycle? How are we handling that, and what do you have any idea what the numbers are?
Yes, so great question. I did start in 1989, at the same time that you started, and I remember getting held over 2 or 3 consecutive days. And unfortunately with COVID, there has been times as early as December and January that those correctional officers were coming to work on those 5 days. They were working probably 3 or 4 16-hour shifts. Absolutely. Now, if you ask me, do I have a shortage of correctional officers? I'm going to tell you no. Right now, I'm at almost 91% fully staffed with correctional officers. Since August, I've graduated 3 academy classes with about 250 correctional officers. Right now in the academy, I got 107 correctional officers that started January 13, 2022, and I'm approved for another 100 to start the academy class in April. Right now, currently, I'm 400 correctional officers I'm short right now as of this morning. I got another 135 correctional officers that will have to make a decision before July 1st, 2022, if they're going to retire or not. But when that academy classes graduates in April, I'll be up at 92%. The department has not been at 92% probably in the last 15 years. What's changed now is the fact COVID has changed. I will tell you that I have 200 correctional officers out on workers' comp. That is the highest number I've seen probably in the last 10, 15 years. I don't think that I've seen that high numbers. I have another, I believe 42 individuals that are out on military leave for longer than 32 days. I have another 26 or 30 officers that are out on long-term FMLA. I mean, so that's right there in the correction office. That's 300 staff members that appear on my roster as coming in, but they're out on some form of leave. And the COVID has increased the numbers of leave based on our staff member needing to address the issues that they may have.
So thank you for that. I just wanted to point out that that we had put that formally moved that program over from UConn and are funding it in now, which I think is an important component, in particular if we're going to have staff under the amount of stress that they've been under. Madam Chair, I have two more questions, but Representative Reyes has his hands up, so I'm not certain if he has, and I don't think he's spoken yet, so I will stop now.
No, he hasn't. Representative Reyes, and I would ask Senator Austin, maybe you can give them to them the questions in writing to them later on. So because we're getting close to time. Thank you, Representative Reyes. Go right ahead.
Thank you, Madam Chair, and thank you, Senator Austin, for the courtesy. Commissioner, good morning, sir. How are you?
Good morning, Representative Reyes.
Good. I'm going to follow up on a couple of things that were mentioned earlier, but I think it's critically important. I still have constituents down here in Waterbury that that do show up at different places of employment and or services and still complain about not having a state ID. And this is something that I think that that I would like to see Department of Corrections get their hands around. And so everybody should leave with some form of ID. And I appreciate that you say you're at 62%, but just want you to know that that's something that's still on our radar. It's critically important for people to be able to function once they hit the streets out here. Number one. Number two, circling back on Representative Porter's comments on solitary confinement. The BPRC strongly feels that this is something that will still need to be addressed, and it's on our priority list for the short session. And we want to continue this conversation, sir, with you. The third thing is, if you could, you can supply these offline. The minority breakdown of the Department of Corrections in administrative and in the ranking positions, if you will. And lastly, you started talking about the report of the folks that you have out. If you could supply that to us, I would appreciate it. But what I would like you to answer is how many officers are out long-term disability? That's the number that I'm interested in right now.
Long-term disability, I will have to get you that information. I don't have it right with me right now. I can tell you that I have 26 correctional officers out on FMLA, whether state or federal, and some short-term, some long-term. It could be short-term, could be anywhere under 30 days. Long-term can be anywhere under over 30 days. So that's 26 just of FMLA. So I will get you the other information as far as the disability long-term.
And Commissioner, you said what is the total number of officers that you're looking for? What is your ideal head count?
So my head count for correctional officer is a little bit over 4,400. Right now I have 400 correctional officers vacancies. I got 107 in the academy right now. And then I know I got another class in April of 2022 with another 100. And I have 135 correctional officers that will be making a decision whether they're going to retire July 1st, 2022.
Thank you, Commissioner. And I won't take any more time in this hearing. If you could just share some of that data with us, I would appreciate it. Thank you, Madam Chair.
Thank you, sir. Is anybody else for the first time? The second time? Anybody else for the second time? Okay. Representative Rosario, is your hand up for the second time, or is it?
No, it's not. I got to put my hand down.
Okay. Okay. Good. All right. Senator Austin.
So, Commissioner, we put in the budget 3 different programs last year for the inmate population. I don't need the answer right now. If we could have those 3 programs been being used? If not, why not? And if so, how many inmates are participating in the program? Just strict numbers. And then I would like to continue the conversation relative to the number of people that we're incarcerating that are chronically mentally ill or with behavioral health issues. It's something that I'm sure you've read as a concern of not just me, but a number of people in the legislature. And I think, and I don't think this is any, quite frankly, I don't think this has anything to do with you. You accept who you get sent. But I'd like to understand what are we doing to provide those. One, I want to get the accurate numbers, and two, I really want to start talking about this much more proactively to deal with the issues relative to the number of people that are not getting the supports they need outside and before they get incarcerated, and end up getting incarcerated strictly as a result of their actions, as a result of their chronic mental illness. So I just wanted to put those on the record, and thank you very much, Madam Chair.
Thank you. Am I muted? No. Thank you, ma'am. And I also want to echo what Senator Austin was talking about the mental health issues with your clients. In looking at your staffing, I know that you said that there are some that were being put in your budget by the governor, but looking at your staffing, could you just break down for us how many mental health staff do you have in your facilities? How many facilities do you have that you have to maintain the staffing there, so that we understand basically, do you have one mental health provider for 300 people? Do you have one for 10 people? How is that prisoner to mental health provider ratio? And in evaluating the mental health prisoners that you have, do you have testing done provided by anybody such as a psychiatrist or somebody in there? That's one component. The other component is when they are discharged, who are you discharging them to? So that we understand, if I have mental health services, are you discharging them to Connecticut Mental Health Center? Are you discharging them to who, when you say you discharge them to the facilities so that they get continued support? You also had talked about the fact that you have a program where somebody comes in early to get them prepared for discharge. We'd like to know a little bit more about what that is. How do we follow up with them? You mentioned that you provide hotels for them through the homeless funding, but I mean, obviously they cannot stay in those hotels. What are we doing to move them out of those hotels? And some of those hotels become problematic to begin with. They become a product of the city then, as opposed to the Department of Corrections or the state. So how is that linkage addressed in there? Because we've had a lot of issues in New Haven at some of our hotels that are taking in people for corrections and from homeless shelters, and overspill. So we're not finding anybody following up. So we need to figure out who's responsible for the population there to try and get them connected to the services. And I do want to follow up. I do want to get information that Representative Porter asked, who is providing you with your methadone services? That's very critical for us, because again, we're seeing that population being placed in areas that nobody is monitoring their activities, and we need to have the person who's responsible for them take responsibility. Not saying you, but it would probably be the vendor that you're really recharging them to. So we need to, as different areas that are receiving the ex-offenders, we need to follow up with them to reinforce their responsibilities when they are discharged. So those are the things that we would like for our subcommittee meeting, so that we can look at that process and see if we need to zhuzh it up a little bit with a little bit of funding, ARPA funding or something like that, that's going to help us address them in the communities that are receiving them openly. And we just want to make sure that when we receive them with an idea of rehabilitation and not just maintenance or ending up allowing them to recidivate. So I thank you, sir, for you and your team. All your team was very good about they didn't jump in, so we got through this pretty fast. So I thank you for that, and I thank you all for your service and working with us so that we can make sure that everything is a smooth sailing for all communities, because public safety is key for everybody. So thank you very much for all you do.
Thank you. Thank you very much. I think Representative Porter has her hand up.
Oh, I'm sorry. I didn't. Representative, she always slides in. I never look up. Yes,
I'm sorry to come behind you, Madam Chair, but you just jarred my memory, and I'm not sure if Representative Reyes made this request because I got distracted for a minute, but I definitely want to ask the good commissioner if he would please supply us with the information of the people who are currently in his care under, and I'll say solitary confinement because I don't know what they're calling it now, but those that are being restricted in such a manner that we consider it isolation. Thank you, Madam Chair.
Okay, I think it's administrative segregation now, isn't it, sir?
Yes. Always been administrative segregation, correct?
Yes, it's new and improved. Thank you.
All right.
Okay. Thank you very much.
Thank you.
Can I make one final comment before we leave?
Yes. Oh, yeah.
So thank you very much for the questions. I'm looking forward to having the conversations with the Black and Puerto Rican Caucus on the solitary confinement and all that. What I need this group to keep in mind, I need you to keep in mind my staff safety. Everything we do, it's got to be safety. I will tell you that in 2021, I had 168 assault on my staff. I went back to when we had that number, and it happened in 2010. We had 152, and we had 18,000 offenders. I got 9,000 offenders. I'm having more staff assaults. So whatever I'm going to engage with in the conversations, it needs to be incremental, and it needs to ensure that staff safety and the individuals that are under my custody. I cannot operate safe facilities if the safety is jeopardized. So I just want you to keep that in mind.
But no, I mean, with no question, we would never want to put anybody, whether it be the staff or the person, the offenders. Nobody should be put in safety. And I just want to point out to you, I mean, I've been talking to a lot of different institutions, and I've talked to the hospitals, and the hospitals tell me that especially in mental health categories, the acuity rate for the clients coming into the hospital is higher than they've ever seen. So we got to remember, it's not just in DOC, it's all over, it's pervasive, it's everywhere. So we've got to not try and make it minimized to just one area. There is an issue that has to be addressed all over because people are in stress, they are traumatized, and they need to be all understood, because we can't fix one or two because that breaks a leak in the dike. It's still going to affect everybody. The most important thing is for us to understand that we have to reduce the stress for everybody in the state of Connecticut in order for all of us to be better and healthier. So we would never say that we wanted anybody to be not safe in their job, and we don't want anybody to be not safe who are in the custody of our state. It's a matter of how do we do it together so that all are still human beings and addressed in the appropriate way. That's all we're talking about, sir, and we look forward to that conversation. So you have a good day. Thank you all.
Thank you.
Thank you. Have a good day, everybody. So that brings a conclusion to our Judicial and Corrections Subcommittee hearing. We will reconvene for, I think, Conservation and Development at 1 o'clock, so that all those people that are on Judiciary can run over and vote and listen to some of the judges for a couple of minutes, and then do a final vote, and then get back onto Appropriations, which is hysterical because many of us are on both of them. And God bless us all for trying to do that. Thank you, everybody, and see you at 1 o'clock. Thank you.
See you in Judiciary, Madam Chair.